for this podcast session on another series which we are doing with Immortal Tortoise, which is a research and strategy firm which focuses on brand and individual health. Anant Jain is a healthcare entrepreneur based out of Jharkhand, which is in the east of India. And in his bio, as he mentions, he runs multiple highly specialized medical facilities. Orchid Medical Center is a 135 bed super specialty hospital in Ranchi, which is NABH and NABL accredited. Iris Super Specialty Eye Care Center is an eye hospital with branches in Ranchi and Ramgarh, all located in Jharkhand. He handles diseases across most clinical specialties with a team of qualified specialists along with state-of-the-art medical equipment. His perspective on the healthcare sector is that it is an essential and emergency service which proves expensive at times. It has inadequate reach, especially in smaller towns. Awareness and education is required for people to use it effectively. So, Anand, that's a summary of what you shared with me regarding your experiences. Over to you. Let's talk about your journey as a healthcare professional and what you made of it so far.
So I've been in healthcare for the last 12 years now, and I mean it's a very interesting sector. One thing is that it's never dull. There's always something or the other happening because like I said, it's an emergency service. We're always operational 24/7, 365 days a year. There's
Right.
always something or the other happening, and you know. I mean, we've seen it grow. I mean, the vision that you have from a facility, it has to be, you have to be open to change because things will not always work out the way that they want it to. And depending on the demand, supply, depending on uh, availability of resources, you will keep modifying it in a way which makes sense to the patients as well as to the organization. Right.
Right.
So, keeping that in mind, the hospital, we're a 13-year-old hospital, and we've grown quite a bit since the day we started, and we've taken a direction which was not really what we had in mind initially. But we're very happy with where we are, and we're optimistic about the future as well. Coming to IS, it's a single specialty eye hospital, which is relatively easier to operate because it's less of an emergency service. I mean, other than trauma, there aren't too many eye emergencies that you would normally come across. But it provides a very different perspective on patients' expectations and what makes them satisfied and dissatisfied from a hospital. So it's been good so far.
Interesting. Okay. So you've talked a bit about the fact that the hospitals are super specialized. So
Right.
could you elaborate on that? Like, what do you mean by that?
So when you talk about super specialties, when you talk about qualification of the doctors, so an MBBS is basically a general doctor, MD or MS on a medical on a surgical side is what you call a specialist. And when you study post your specialization, post your post graduation, that is how you define a super specialty. So the doctors are generally, post MD or post MS, they would have done a DM, MCH or a DNB course, which would allow them to be categorized as a super specialist in that particular field. For example, if there's someone who's an interventional cardiologist or a nephrologist, gastroenterologist, then there is a certain additional level of educational qualification that they need to accomplish in order to be considered. And as a hospital, if we are able to provide treatment of that specialty with doctors who have that qualification, that is how we can consider ourselves to be a super specialty.
Okay. Interesting. So tell me something like earlier when we were growing up in the
Right.
90s and the early 2000s, there always used to be a GP, a general physician.
Yeah. Yeah.
If you had an ailment or a fever or a constipation or anything, you went to a GP and he
Yeah.
fixed you. Right?
Hmm.
But now the GP has almost become an endangered species. You
Right.
go to a hospital and the person who's a diabetologist will say you go to a urologist,
Right.
urologist will tell you go to a radiologist. So how does this entire business work? Can you help us understand that?
So there are a couple of reasons why it has turned out this way. When when we were growing up, when we were kids, there was no concept of super speciality. I mean, an MD and an MS was a specialist and was considered to be more than adequate to provide specialized treatment. But
Hmm.
now things have changed because of these. One is, of course, advancement in technology, and the other is availability of these courses because of which super specialists are far more freely available. And
Hmm.
the other part is the medical legal part. I mean, earlier it wasn't so complicated. One doctor could treat diseases across a spectrum of specialities without
Hmm.
any, with their best intent and
Hmm.
without any fear of repercussion. Things have
Hmm.
changed now. So now, if say a general practitioner treats a kidney condition or a cardiac condition, and he makes a mistake, which is not
Hmm.
obviously not his intent,
Hmm.
it's very likely that someone may file a legal suit against that person, and so
Hmm.
people want to avoid taking that risk, and it is not really a
Right.
dispute anymore.
Right, right. I get that. Okay. So talk to us a bit about the kind of patient care you provide. What are the kind of cases you get? Are they mainly cases of severe medical emergencies? Are they chronic conditions? What are the kind of cases that you usually handle?
So the focus of our hospital is critical care. I mean, we have a very large percentage of beds are allocated to critical care, which is more than the norm. You know, so we get a lot of patients who are very very sick, and we get a lot of patients who are referred from other medical facilities from the vicinity of Ranchi, where say specialized treatment would not be that well, that advanced or that easily available. So
Right.
now, because the patients are critical, as some of them suffer from chronic conditions, some of them suffer from diseases across multiple specialities. So they may parallelly have a cardiac, renal, and maybe a liver problem, and
Right.
they suddenly had a say road accident. So there will
Right.
be diverse team of specialists who would have to treat that patient, considering every clinical aspect in mind.
Okay.
So that is the and so other than the single specialty hospitals, most hospitals nowadays handle multiple specialties. So that is the patient mix that is common in most places.
Okay. Okay. So, and how does it handle? Like, do people mainly uh, pay for the expenses through insurance? Is it through cash? How does that business work?
So that's it's very interesting. The trend has changed completely in the last 5 years. So pre-COVID, we had around 25% patients who would pay through insurance or through their corporates, and
Hmm.
75% patients were paying by cash. Right
Hmm.
currently there are less than 40% patients. I would say around a third of the patients are cash patients. Around
Okay.
one third are insurance patients, and around one third are covered in government schemes.
Okay.
So I mean
And
that
what?
would be the trend in our
Yeah, yeah.
hospital. Yeah.
And what do you think has led to this change?
So post-COVID, people got a very big scare. People understood
Hmm.
the importance of investing in health, and a lot of
Hmm.
people bought insurances, or they had their children who bought insurance and got them enrolled as dependents. And
Hmm.
additionally, the government are also very aggressive and proactive with their healthcare schemes. Ayushman Bharat came out, it's
Hmm.
growing in popularity. The central government schemes, the number of dependents, the number of private hospitals that are also being enrolled in that scheme has increased. That is
Hmm.
also increasing the number of credit patients.
So, would you say it's more awareness or is it more compulsion?
I think it's more awareness, and from my perspective, I think it is very important for people to have insurance
Hmm.
because most people don't plan for emergencies, especially healthcare
Hmm.
emergencies.
Hmm.
So it's always good to have that cushion because some. some treatments turn out to be quite expensive, and
Hmm.
it's not always very simple or easy to generate that fund readily.
Hmm.
So having that insurance is a big question. It makes people's lives much simpler.
Right, right. Okay. Let's talk about something else, which is something which is quite top of mind when it comes to healthcare. Is that a lot of
Right.
people, especially senior citizens, including my parents, in fact, when they have
Mhm.
any medical issues for which they need treatment from doctors, they are skeptical of going to a hospital because they feel that in a hospital there will be tests, there will be medicine prescribed, they will be asked to stay for a few days, there will be an outflow of cash. So, how do you tackle these kind of circumspections?
So, it's, I mean, look, every patient has to be dealt on a case to case basis. Some patients require admissions, most don't. I mean, if I look at the numbers in our hospital, I think 10% of the patients coming into the OPD, generally tend to
Hmm.
get admitted. Most of them,
Okay.
they now tests again. Generally, like I said, from the medical legal part, if someone goes to a doctor and says that I am suffering from this condition, then the
Hmm.
doctor would probably prescribe tests to verify whether the condition exists or how severe it is. Right.
Right.
And in some cases, the patient's perspective of the disease may not exactly be very accurate, or they may not define the symptoms correctly. At the same
Right.
time, doctors tend to, you know, have always prescribed one or two tests based on their own clinical judgment. Right. So some
Right.
of the sometimes, you know, uh, it is not always that they're able to hit the nail on the head in the first go. So there is always a
Hmm.
process of elimination as well. So they might want to
Hmm.
eliminate certain diseases. So that is why tests are prescribed and correspondingly medications will also be advised. But it's not that universal. I mean, everyone would not generally have a test or a medicine prescribed. It all depends on the patient condition. Having said that, it also depends to a certain extent on the doctor as well as the hospital.
Right. Right.
So, it,
Yeah, so I'll tell you a case recently which happened in front of my eyes with my mother.
Mhm.
So my mother is diabetic, right? And she wasn't on insulin. And she had a high HbA1c. Okay.
Mhm.
So we went to a doctor. I won't take her name. We went to a doctor, and she said that until and unless you agree to get admitted to a hospital, I will not write you a prescription. Okay? So
Okay.
we unwillingly said, okay, fine, we will go to a hospital and get admitted. Straight away, she called up a colleague in a nearby hospital and said, I'm sending XYZ to
Mhm.
your hospital, take care of it. So there is this network of doctors which also exists, right? What would you say about
So,
that?
so you know, look, it does happen, but it's not universal. So it's always one rotten apple spoils the
Correct,
basket. That's the case. So look, there are lots of doctors, there are lots of hospitals, and you know, everyone does not have a very clean and ethical mindset. So unfortunately,
right,
and it causes harm to the entire community because
correct,
if you have a bad experience, it's very difficult for you to trust the next person even if they have a honest intention.
right. Hmm. Okay. So let's talk a bit about mental health now, right?
Yeah.
Like we've talked a bit about chronic ailments, we've talked a bit about even stuff like diabetes or liver issues, for which we
Right,
come and for which whom we have super specialty doctors
right.
who take care of them. Right? What's your take on mental health and the awareness and the treatments available at your medical facilities?
I think mental health is a very important and very under what should I say? I mean, it's a very important health sector which is very highly neglected. I mean, it's still a taboo topic for most people. People find it,
Right,
consider that they may have problems which are not related to their physical health, and the facilities available are highly inadequate. they
Right.
are highly unpleasant, and for people who may not be very, you know, it's not that everyone who is suffering from mental health issue is on the extreme spectrum. Right? There will be people with
Right.
mild and moderate conditions as well who could not require
Right.
major interventions, and the facilities available for them are, painfully low. I
Right.
mean, uh, Ranchi is known for its mental health facilities. We have
Right.
pretty much the largest government setup in the state. It's available here. However,
Right.
like I said, I mean, to go, we have a very very basic mental health setup here. We have
Okay.
psychiatrists available, we have neurologists available, but it is more of an OPD based consultation services available. Some patients
Okay.
who also suffer from mental health conditions do get treated in post admissions, but uh, I mean, if there is, like I said, if it's between a mild to moderate uh, spectrum, we may be able to address it, but when it starts to go on the higher side, when say the patient is very restless or aggressive or violent, which can
Right.
happen in certain conditions, then
Right.
we're not geared for handling such situations. I mean, because it requires a very specialized kind of infrastructure, it requires specialized, the people handling those patients, whether it not just the doctors, even the paramedical staff, have to be trained and sensitized accordingly. Otherwise, they may mess
Right.
things up.
Right. So, as you mentioned, mental health is a growing need for India, especially with its
Yeah.
large young population, which is overworked and has less time. Relationships are falling apart in every household. So, do you see let's say, a business opportunity over there for your hospital to expand and provide better and more enhanced mental care facilities?
It is definitely an opportunity. It is it's a conversation that we've had internally, on and off for the last couple of years. But and it is definitely an opportunity because we also get patients who would like a lot of people would want to be treated in a comfortable facility for mental health as well.
Right.
Unfortunately, most mental health facilities are still in the government, in the public sector. So
Right.
it is definitely an opportunity, but it comes with its own set of challenges, which is probably
Mhm.
why a lot of people have not, a lot of larger corporates have also not really waded into these waters.
So talk to us a bit about the asylum which you mentioned in Ranchi, which is pretty well known. I mean, I
Yes,
know
yes,
of psychiatrists in Calcutta who are practicing after having trained over there. So have you ever
right.
thought of collaborating with them or any kind of partnership with them?
Look, it's a very government facilities will generally not collaborate with private facilities. I mean, it doesn't really
Okay.
work that easily. So, I mean, and like, we have a very, very small workload of mental health patients, right?
Okay.
So, we generally don't handle cases where of patients whose primary problem is mental health. It may be
Okay.
a secondary or a tertiary problem. So,
Okay.
and the patients who, we have two mental health institutions run by the government in Ranchi. One is
Right.
CIP, which is the Central Institute of Psychiatry. The other is
Right.
RIMPAS, which is Ranchi Institute of Neuropsychiatry, I believe. Not
Right.
very sure about the full form. They're both very,
Right.
very large institutions. And
Right.
they're also teaching institutions. They have well developed infrastructure. I haven't been there personally, but
Right.
it's a fairly busy institution. So I'm sure there will be doctors across the country who would be from this place. In fact,
Right.
uh, till say the early 90s and all, if anyone thought of healthcare and Ranchi, then the
Right.
primary connect would be that the doctor would probably be a mental health doctor.
Correct. Right. Interesting. So let's move away a bit and talk a bit about doctors and their place in society. So in ancient times, doctors were healers, right? A
Right.
doctor was a privileged figure in society, right? If anybody had any problem of, let's say, depression or diabetes or
Mm.
liver or constipation, they would go to a doctor and the
Right.
doctor would fix them. Right?
Mm.
In modern times, in the 21st century, 2024, as we speak, doctors have almost become a business in many places. Right? You have to seek an appointment, they charge high fees, they keep asking you to come every 3 months, and they keep you at the beck and call, and you are dependent on them in a certain sense. So, how would you regard upon this change that has happened in society when it comes to our perception of doctors?
I think they're being a little harsh because it's not changed that much. I mean, even earlier you had to, in order to go to a doctor, you would book an appointment, pay the
Right,
fee, and follow up because that would be required in many conditions. There are
right,
very few conditions in which you would go and uh, a single appointment would be adequate to solve the problem.
hmm,
So it has changed. It has changed, of course, and some doctors are more business oriented than the others. So, uh,
hmm,
but otherwise, I think doctors still enjoy a privileged position in society. They perform a service which is which everyone needs from time to time.
hmm,
So, I mean, judging from our backgrounds, our direct contribution to society is much lower compared to what doctors do on a day-to-day
hmm.
basis. So
Right,
they do so they still enjoy a privileged position. Some have become business oriented, but it's a little harsh to consider to generalize it to the entire community. And
fair enough.
even in your experience, I'm sure you would have come across some very nice doctors,
Yes,
some who would not have been as nice, and some who would have been, downright transaction oriented. So,
correct,
eventually, the patients also unfortunately have to figure things out on their own whether the doctor meets their requirements or suits
correct,
them. Very
correct,
often you have patients who would also reject a doctor if they don't agree with the line of treatment that the patient has.
correct.
So, and now with the internet and with so much information available, a lot of times people would search for symptoms, search for treatments, and then they're not happy if the doctor does not agree with their research, which is
Correct.
based on very little
Correct.
information. So,
Correct. Correct. That is true. Yes. Yes. Okay. So let's talk a bit about Anand about how the doctors go about treating patients. Right? So
okay,
I understand. Let's say there's a trauma case. Somebody has a bike accident. Right?
sure,
So
sure.
they come in and they are operated on, or whatever prosthetic is applied, and they are made functional for life again. Right? But
Right.
what about chronic symptoms like, let's say, diabetes, right?
Mhm.
Which is a lifelong condition for which
Right.
there are very few really reversible cures. Right? So
Sure.
if somebody comes in with diabetes and they have a
Mhm.
high HbA1c and a high sugar count, what is the approach followed at your facility A? And B, does the doctor follow up with them to ensure that that condition doesn't repeat? What would be your thoughts on this?
So, Harsh, how it works is, I mean, as part of the administration, my involvement in the clinical side is virtually zero, right?
Hmm.
Because doctors will only be able to function if they have their own independence in handling clinical cases as per their judgment.
Right,
So, say if there is a patient with a chronic condition like diabetes, they would generally, present to the doctor as an outpatient. They would not have to get admitted in most cases. So
okay,
they would meet the doctor, they would have a consultation, they would describe their symptoms, and the doctor may advise some investigations if he wants to ascertain the extent of the disease, or if they
right,
have, in a lot of cases, patients bring their own reports. Right? They may have
Okay.
gotten some tests done. So on the basis of those reports, they would advise some medication, and patients are advised a regular follow-up depending on the condition. So the frequency, the duration would all depend on the condition of the patient. And
Okay.
doctors will generally not follow up because it would not really be interpreted in a positive way. Because
Hmm.
say the patient is not satisfied with the doctor, they may choose to go to someone else and not come back.
Hmm. Correct.
So in that case, if the doctor is following up, it would not appear to be a good thing. So
Correct.
that is where the role of the hospital comes in. That say if a patient is advised a follow up after say 50 days, then someone
Hmm.
from the hospital would generally call say after 25 or 28 days that you have an appointment for you've been advised a follow up on this day. In case
Right.
you're planning to come, then we could set up an appointment. So
Right.
that is how we can try to follow up.
Okay. 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 So coming towards the end of our conversation, I'd like to talk about two things. One is the business side of healthcare, which
Mhm.
is how you differentiate your hospital from other hospitals in Ranchi, and whether you also cater to people from outside Ranchi.
Right.
And secondly, the future of healthcare in India, according to you. These are the 2 points I'd like to discuss.
So we handle patients from most parts of the state, and even from the bordering parts of the neighboring states. So we get some patients from say Bengal, Orissa, Chhattisgarh as well. For whom Ranchi would be the closest medical city, according to their geographical location.
Right.
Having said that, there are some parts of Jharkhand which are closer to Bengal. So the patient for those patients, it takes the same amount of time to reach Ranchi than to go to Calcutta. So most of them go to
Right.
Calcutta, right?
Right.
Uh, Healthcare is a high capital expense and has high operating expense. So
Right.
margins are not as rosy as people tend to believe. There is a very big difference between revenue and profit. And
Right.
when patients, and like I said, people are not prepared for healthcare expenses. So people are always
Right.
unhappy when they get the bill, and there is a lot of haggling. I would like to have a discount. I would want a discount on this and that.
Right.
So it has its own commercially. If it works, it's a good business. There's no doubt about
Right.
it because it is not as seasonal. It is not that affected by economy and recessions and wars and everything. I mean, during
Right.
when healthcare was working during COVID, when most of
Right.
the world was. I mean, in fact, it was the first wave, not the first wave, but the second wave was insanely busy. So,
Right.
as a business, it has its own set of challenges. The biggest being that margin of error is very low because
Right.
matter of life and death is a reality. It's not just something that you say.
Right.
So,
Right.
you know, handling that is a bit of, I mean, there's a lot of compliance, there's a lot of quality control, there's a lot that you need to do to be able to go and sleep comfortably at night, knowing that,
Right.
no, nothing went wrong in the hospital.
Right.
Uh, Talking about the future of healthcare in India, I think, we have a bright future. Right now, the
Hmm.
number of healthcare facilities, the number of doctors in the country is still very, very inadequate. But
Hmm.
a lot of work is being done. We have a lot of medical colleges coming up. We have a lot of hospitals coming up. Now,
Hmm.
you would have noticed that post-COVID, a lot of and medium-sized hospitals mushroomed everywhere in the country.
Hmm.
But now,
Right.
some of them have been forced to shut down because it's not that simple and it's not that straightforward. So it's a combination of a lot of factors, and luck is also an important factor to
Right.
help you uh, establish and be profitable. But
Right.
there's a huge, technology is advancing. A lot of treatments are becoming cheaper. There
Hmm.
are a lot of a big cost in healthcare is medical equipment and the infrastructure, and
Hmm.
it is mostly imported. So
Hmm.
the cost of a say an MRI machine in India is
Hmm.
is similar to the cost of an MRI machine in, say, Europe or in America.
Right.
And so, because of that, it's expensive for us.
Right.
Right? But the government is trying under Make in India. There are some companies which are trying to crack the medical device and medical equipment uh, manufacturing code as well.
Right.
So hopefully in a few years, there will be companies that will emerge with who can manufacture in India and manufacture at a level with a quality which is, you know, uh, which provides confidence to the doctors and the patients that it is good enough for use.
Right.
That will greatly reduce costs and make it accessible, make it approachable. Uh,
Mm.
Ayushman Bharat has been a game changer, especially for the poor
Mm.
people. Uh,
Mm.
it is working. I mean, patients are at least they're getting care in a lot of hospitals, and because up to 5 lakh rupees the treatment is guaranteed by the government.
Mm.
Most of the diseases get taken care.
Correct. Correct. Okay. Before we conclude, Anand, I'd like to just focus on one point which you mentioned in your perspective on healthcare. Where you said awareness and education is required for people to use it effectively. Could
Yeah.
you elaborate a bit on that?
So I think there are two aspects to it. One is preventive healthcare is not is something that people need to focus on. You should not wait to fall ill before start. There may be something inherently wrong which is not it's not reached a level where it's affecting your life physically or mentally. But
Right.
if people go for regular routine checkups, maybe every year, every couple of years, they may be able to identify some diseases early, which would be, and then for most diseases, early diagnosis leads in better treatment.
Right.
The other part is that whether it is insurance, whether it is the government healthcare schemes, a lot of people are not aware of what is included, what is not included, what you'll have to pay,
Mm.
what you'll not have to pay, and you
Mm.
know the people would be telling them, say maybe the insurance provider would generally not tell them everything. Right? People assume cashless means that I will it is free. It doesn't work that way. So,
Correct.
and a lot of people, don't understand the importance of having high coverage for their insurance. I mean, it is good to have insurance in any form, but if it is at a
Mm.
value which would really help you financially, then it is more
Mm.
effective, right?
Mm.
I mean, I always feel that people should buy the highest coverage that they can afford so that
Mm.
if there's something, there is a major problem, say there is cancer or an organ transplant that is required,
Mm.
the treatment costs are, very, very high. And
Mm.
regardless of where you go, it's not that it will be
Mm.
high in one particular facility. Other than government institutions, any private
Mm.
facility would be very expensive. So,
Mm.
and these are diseases which can actually break a family. I mean,
Mm.
we see cases where people have to sell land or sell ancestral property in order to raise funds to get treatment, and it is a very
Correct.
sad. It's not. It's a very sad situation because raising funds doesn't. Expensive treatment doesn't necessarily mean that the patient will be fine. Despite all
Mm.
efforts, the outcome may not be as one hopes. So,
Mm.
that is what I mean when I talk about awareness. People need to understand that insurance is important and taking care of themselves before things go wrong is also very important.
Mm. Interesting. Okay. Last was Anant, on people who want to enter the healthcare industry, either as doctors, nurses, or maybe want to start a hospital of their own. What
Right.
advice or what would we tell them?
Don't do it.
Elaborate on that, please.
Look, it's not. It's not. It's a fairly unpleasant, industry. I mean, there are times when you enter the hospital, you see people crying because they've lost a loved one, right?
Right.
And everyone wants someone to, everyone wants to blame someone when they suffer a major loss. So
Right.
whether it's the doctors, whether it's the hospital administration, whether it's the nurse, whether it is the person at the reception who is, getting the documentation done, nature, when they're aggrieved, they tend to lash out. And
Right.
in recent times, litigation has increased significantly. So
Right.
people are overly cautious. I mean, they will want to put everything down on paper so that no one comes
Right.
back later and blames them for negligence or malpractice or anything.
Right.
And
Right.
but having said that, it is everyone. It's an essential service. I mean, you have to have doctors. You have to have hospitals, and the hospital is not just doctors and nurses and you know the clinical staff. There's a large number of people in the support team, whether they're the cleaners, whether they are the operational staff, whether it's the reception staff, who all have to come together to make sure that patient or their family has a pleasant experience or a less unpleasant experience because
Hmm.
hospitals generate a good amount of employment. So, it's good for the economy as well. Uh, and for people who are getting into the industry, I mean, doctors know what they want to do. So,
Hmm.
they're generally motivated, they're generally fairly well aware. When it comes to the support team, I mean, look, the opportunities are only going to increase. The number of hospitals that are coming in, and there's a large consolidation happening. So we have some very large chains who are, sort of dominating the industry at this point. Then there will be smaller hospitals or large single hospitals that will come up. So the scenario will keep changing. Uh,
Right.
Hospitals that were in existence 10 years ago or 5 years ago have now merged with other hospitals. So things keep
Right.
changing. It's very dynamic, but it's a growing sector. And there are lots of
Right.
opportunities, and you won't go wrong in going taking it as a career option. But you have to be prepared that you know your customers are people who don't want to be there. Like no one
Hmm.
plans to go to other than maternity patients. Everyone who comes to the hospital is unhappy.
Correct. That is true. Any parting thoughts? Basis our discussion. Any other insights you'd like to share?
No, I think any look, I never imagined that I would be in healthcare. I mean,
Hmm.
and educational background also indicates that. I'm
Hmm.
pretty sure if I knew I would be doing this, I would not have tried to study so much because my education is not very useful here. And in the end, most things come down to common sense. I mean, if you have
Hmm.
you just have to have some basic intelligence and some basic common sense, and you'll be able to figure it out. Of
Right.
course, luck is always a big factor. You have to
Right.
uh, you could do everything right, it may still not work because there is always some intangible, unexplained support that you need to get you in the right direction.
Fair. On that note, let's conclude, Anand. Thank you for your time. This is Harsh Maskar, Anant Jain signing off from